Welcome to the Talking HealthTech podcast. My name is Peter Birch. I'm here at HIMMS25 in the Dedalus booth, and I'm joined by Tracy McClelland and George Patapis from Dedalus. George, Tracy, how are you?
We're fantastic.
Yes,
it's good to meet here in HIMSS, eh?
Yeah, right.
25.
We had to come all the way to the other side of the world so that we could catch up, George. But look, you know, there's good things happening when you're that busy to do that. So we'll dive into what's happening at HIMSS probably a little bit later in the conversation. But I'm really keen to, in this conversation, learn a little bit more about ORBIS, a bit about the work that Dedalus is doing, and just generally about the conversations you're having with participants here at HIMSS. So firstly, just to get to know you a little bit better, Tracy, I might start with you. Tell us a little about you and what you do.
Yeah, hi, nice to meet you. I'm Tracy McClelland. I'm the CCIO for UK and I. I'm a nurse by background, and I've been qualified for the last 28 years, but working in Australia and the UK. And I've been the CNIO and now the CCIO for Dedalus UKI for the last 3 years.
Amazing. Thank you. And great to hear from you. George, what about you?
So I've been now with Dedalus over 18 months. So my background is health information technology. I currently lead the EMR business for ANZ, the commercial business lead for our ORBIS offering, which is exciting. And obviously here we are demonstrating some of that capability. Prior to that, again, I've worked for Australian organisations in healthcare. I've had the opportunity to immerse myself in some national health screening programs and also the National Health Record solution. So a bit of a long history in that regard, and very much keen to bring some new innovations such as ORBIS to the Australian audiences and Australian hospital sector.
Yeah, amazing. And love to a good opportunity to learn a little bit more about ORBIS then. Tell me a bit about what it is and how it works.
So ORBIS is our EPR across Europe. We've got 1,000 sites live across Europe, DAC, France, Spain and the Nordics. And we've brought it to the UK. We've got 3 sites currently going live with ORBIS across the UK. And we've worked for the last 2 years on localising the solution, making sure we have a standard content in terms of the clinical content along national guidances and clinically evidenced content. We also have the functionality to work on localizing content with the clinicians on site. So whilst we have that structured core content, we're able to create localized structures and pathways and processes with the clinicians on site as well.
Yeah.
So we spent the last 2 years working on that, and also working very, very closely with the Australian team. There's a huge team of clinicians across the UK and Australia working on those localizations. And on the Australian localization, I'll pass to George.
Sure, and before we jump into some of the work we're doing in Australia, I guess the background was predominantly within the Australian market. There was a dominance of mostly North American firms with EPRs, or what we call an electronic medical record in Australia. And practically Dedalus has had for a number of years a large presence with ORBIS across what we call major European regions like Germany, Austria, Switzerland, Luxembourg, and now with expansions into UK and also in France, for example, some of the largest deployments. So there has been some background and history to ORBIS, and bring it to the Australian market. As Tracy mentioned, our teams and our clinicians on the ground are working to localise it for some of the requirements, compliance and reporting, areas like medication management, and practically provide an additional option, right, to the healthcare sector, because Dedalus in Australia covers both not-for-profit, private hospitals and public sector hospitals across the board.
Yeah, no, there's a good breadth of the ecosystem to cover there. And from, previous conversations with Dedalus, great partners of Talking HealthTech, so we've covered a bit of ground historically, and what I know is that clinician focus is super important to the work that you do. I'd love to hear from either of you on how ORBIS in particular is kind of shaped to really meet the needs of clinicians, because the last thing that clinicians need is to be a slave to another EMR. You want to make sure you're creating something that's actually adding value back to clinicians so they can do their job.
Yeah. So we've made sure that our EMR, that ORBIS, is built by clinicians for clinicians. And some of the functionality we've put in there is supposed to make the pathways really, really efficient. So we've got all of the clinical information visible in dashboards. We've made sure that all the summary information for a patient is visible in one screen. And from that one screen, you can click through to the whole medical record. So as a clinician, you don't have to search through the whole of the EMR system to find that relevant clinical information. It's already there for you on your landing page. Also, as a nurse or an ICU clinician, you can see tracking information on that one screen. You can have clinical decision support. So when you're completing your early warning score information, for example, or your Manchester triage score and your ED triage, you have the functionality within the system to notify you that someone's outside of a normal parameter, and then also recommend the next steps to take. So, for example, should that be a sepsis pathway? And if you want to follow the sepsis pathway, you can see the evidence to support that and click right through to that whole pathway for a sepsis support, and also the same for AKI and a number of other clinical decision support systems within the solution. We also made sure, as I said, the UX is really, really usable. That's very important to us, that the solution is as usable as possible. So we have a whole team of clinicians focused specifically on UX. So they're UX experts, making sure that the solution is as usable as possible.
So we're here at HIMSS, and the talk of the town is definitely artificial intelligence, and there's a lot of different ways that can be applied into a healthcare setting. Are there ways that artificial intelligence are being incorporated into ORBIS that clinicians
can absolutely. It's a top priority of ours. We know that globally AI is very much the mission for healthcare systems. Germany, US, UK have got it in their strategy for their national strategies. So within ORBIS, we have a number of AI functionalities. Within Germany and Europe already, we have a number of clinical predictors, CE marks within the ORBIS solution around AKI, sepsis, delirium, post-operative delirium, and DVT. And as I said, there's the medical devices that are already used across Europe that are certified to be used by clinicians. We're rolling them out to the UK, and over 2025, we're expanding that to include falls risk and cardiac arrest risk. So when you get those laboratory results back, or those results from your vital signs, you can immediately know as a clinician, this is the triggers, and this is the way that I need to take the patient through for the next assessments. And currently it's used in 19 hospitals across 138 sites and different units, treating around 9,000 patients a day. So it's quite widespread already in terms of its usability across Europe.
And we know too that a lot of the capability is good to have in principle, but any artificial intelligence or technology for that matter is only as good as the clinicians being able to actually use it, and adoption of technology is always something that needs to be addressed carefully in healthcare. Where do you see potential barriers in clinicians potentially utilising some of these technologies, and how might you overcome them?
As you said, training, so making sure there's training there so the clinicians know how to use the solution, that they have confidence in that the models that we're using are safe and effective, and the AI modelling that we've developed has gone through a whole ethics committee in Dedalus. We have clinicians, ethics experts, data model experts all involved in our AI creation. The data needs to be available, so there's no point in having AI functionality if the data in the source system isn't there to be able to inform the clinicians, and also that the evidence base is 100% effective.
Yeah, and just talking about the data, practically for the Australian context, we'll certainly be also going through TGA approval for some of these predictors, but also we train the models and refine them on the customer's data. Right, so for example, if we go into one of the health departments, we'll be leveraging their data and applying it and being very specific there. So we're not just using generic data and refining that. And I think for us, that ability to embed it in the EMR and have it as part of and accessible to the clinicians, we see that as a positive.
Yeah.
But I'm also cognizant there's other elements of AI and other capabilities aside from predictors that are being talked about?
We do have additional AI functionality on top of the predictors. So we have ambient listening within the solution, so large language modeling. We have document creation, so the creation of a discharge summary throughout the admission using AI functionality. And we are currently using wound care support. So we have a solution which assists with the measurement and tracking of wound care, helping nurses give really, really efficient care and ensuring that the measurement, the documentation of that wound care is 100% correct. And that's utilizing AI functionality, but supporting the clinicians rather than replacing their clinical decisions.
I feel like there's a consistent theme across those different applications too, where you're utilizing the right tool for the right or the right resource for the right job. So when there's large amounts of documentation required or sorting of information, whether it's clinical or administrative, freeing up those clinicians to be able to do the work. I think that it's pretty clear that it's only enabling more clinicians to be able to do some more things with patients as opposed to anything else. And it's kind of that balance, though, always with artificial intelligence. And as you say, we can do a lot of great things with data and making that more accessible to our systems and opening it up and unlocking value and all of that. But we're dealing with patient-sensitive information, and there's it's mission critical to have all those points around not just privacy and security, but also the ethics and the use of the information as well. I'd love to unpack a little bit with you about the way Dedalus is kind of addressing some of those really critical points while we're going on one side, a lot of innovation with the use of data, but also being secure.
So, as I mentioned earlier, we have an ethics committee involved in the creation of all of our AI functionality, and that involves clinicians, ethics experts. We make sure that we take every model through that ethics committee, that all the data is modeled by data scientists, and it all has to be approved. We ensure there's patient consent, and that we regularly track for bias to make sure that there's no bias in terms of gender or ethnicity in terms of the results that we're getting, and also the fact that sometimes incorrect data can be there, so make sure that the data mining is done correctly and that the modeling is done correctly.
Yeah. Now, they're important points. I think about, just what I mentioned before about freeing up clinicians to be able to do more, spend more time with patients. But, as we know, in Australia and the rest of the world, to be fair, the amount of clinicians that we have to do the work that we need in the right areas, can be lacking at times. So I'd love to understand, maybe from the Australian perspective, but, there's also, I feel like it's a global, point that, is there opportunity to leverage some of these AI tools and productivity and scalability of some solutions to address some of those really hard problems of, addressing care gaps and the lack of clinicians that we have in certain areas?
Well, certainly, and when we're talking about ambient listening, for example, and the intent there is to free up some time in terms of transcribing and enabling more time back to clinicians. So obviously that's being tested and being leveraged. But I also think when you're building in tools that analyze a lot of data that does come through with these systems and can give you some insights or a second, opinion, practically you're also able to utilize to the best of their capability registrars or what have you, right? When they're needing some guidance. And basically it's a combination kind of items, right? There's no silver bullet, but a number of tools.
Yeah. We also have population health screening. So we have a command center that sits on top of ORBIS, and we're able to look at the data. If we have the data available from the community systems, we're able to look at population health data, not just across our EPR, but across the population. And we have AI within our Clinalytics system, which can read that data and help with cohort identification, can help with identifying patients that are at risk of certain conditions. So patients that have certain comorbidities are more at risk for diabetes, for example, and then we can support the clinicians in terms of screening patients or informing patients or educating patients so they take the right lifestyle and moving more to a well-being and prevention model rather than acute and responsive model.
Yeah. It's a bit multifaceted, isn't it? There's elements of being able to free up time and reducing the amount of admin from a clinician point of view. To George's point as well, allocating work to the right individuals, because there's a lot of capable clinicians. Doesn't have to just be the doctor that, and some that are more capable than a doctor to be able to provide the level of care that a patient might need. And also to that command centre point too, there's leveraging clinicians that might be in other parts to really make the most of things. I'd love to get, since we're in amongst the hustle and bustle of HIMSS as well, it's great to be amongst a lot of other healthcare innovators and healthcare systems too. And there's always been a lot of activity here at the Dedalus booth. I'd love to get your take on, over the last couple of days, the types of conversations that have been had and the problems to address, particularly in the US region, but I notice there's a global audience that are attending here too. Any initial thoughts come to mind?
Yeah, I think mainly the conversations that I've had anyway, I'll let George answer for himself, have been around AI again, also around interoperability and the fact that you can have a landscape across a hospital ecosystem, but it is ineffective if you can't integrate and share data. So having those open standards and open air is really, really needed and really, really effective. As we said, AI is a theme, I think, across most of the suppliers and the keynote speeches that I've seen.
Yeah.
And the different adoption methods that they're being used, US versus Europe and Malaysia, the different ways that that's being implemented and the cautions that have been used, but also the fact that it's being pushed from a federal level in pretty much every country globally right now, the fact that they're wanting to incorporate and utilize AI to support clinicians to be as effective as possible.
Yeah. What about you, George?
I guess even at a basic level, people are really interested to learn a bit more about the ORBIS and then even Dedalus. And we were very humbled to win a class award a couple of nights ago in Europe, sitting here. So I think that's certainly getting people interested in finding out a bit more. In particular, also, like any other EMR, there's quite a number of other companies and solutions that you need to integrate with and interface with. And certainly a lot of capable startups and innovators and medical device organizations would like to also ensure that we can integrate with them as the systems are deployed in clinical settings. And this is probably one of the largest events where so many people and so many third parties are also here. So for me, it's been, I think, an opportunity to share on what we're doing with ORBIS, to raise and then make Dedalus more, lift the profile, but also then engage with so many also third parties.
Yeah, and that's that. So it's the innovation and also the collaboration. So the collaboration we can have with our customers, but also with our colleagues and the other suppliers that we work closely with.
Yeah, and I would think, George, too, from the Australian perspective, being able to take back some learnings and perspectives on, what the hot topics are here in the US. I'd love to hear from you too, because, good understanding of the Australian healthcare system and those different areas, as you said, public, private, not-for-profit, and everyone's at a different stage of EMR. Maybe just to close this out, just thinking about some of those needs in Australia. Look, sometimes we look to other parts of the world and they're ahead in terms of innovations. Other times it's humbling. We're like, we're actually doing not too bad here in Australia. What are some things that you might be taking away from HIMSS that you can bring back and share with other healthcare systems in Australia, or just generally what you're looking forward to in terms of 2025 and the sentiment towards EMR in Australia, particularly in relation to ORBIS?
Sure. First of all, a big topic here at HIMSS, by the way, I found cybersecurity having a whole chapter of its own, right? So that's something that I think is going to be an important focus for all of us who are providing solutions to the healthcare system. Within an Australian context, I think what I'm noticing is this gap between public sector and what I would say private sector, not-for-profit, in terms of capability and investments in tools like an EMR. I think certainly in the US, a lot of also private institutions have best of breed and capabilities around technology. And I've just come from conversations, some of our private hospital and customers, that don't have that level of support and funding in the Australian context to be able to adopt some of the new technologies. Certainly within the Australian context and ORBIS, we're looking to make it, possible commercially and technically for even private hospitals to get on that journey, that digital journey, and not to require, $1 billion to be able to leverage the latest technology. That's a goal of ours in Australia, and we certainly think with a new proposition with ORBIS, we can not only address public sector, but also the private sector needs in terms of technology.
Yeah, and it's good to be able to have that flexibility to be able to take, what's from the global offering and then, provide those localizations that are specific to the Australian market. So that's really clear. I guess, Tracy, then lastly, anything else from the overall Dedalus perspective? Lots happening in different parts of the world. What can we look forward to seeing on your side as you're continuing to speak to more customers across different parts of Europe and everywhere else?
Yeah, I'd say to close off, we work really, really closely with our customers. So we have customer user groups. So we're constantly learning and evolving and innovating our solution around customers' needs. So we've done that across DAC and France and now with the UKI. I work really, as I said, really closely with the clinicians in the Australian team. So we look forward to working with our Australian customers on constantly evolving around the clinical needs of the Australian market. So it's not a deploy and go solution. It's a deploy and optimize and keep supporting you throughout the utilization and the constant improvement of the solution.
Yeah. Amazing. Well, look, Tracy, George, I really appreciate making the time to have a chat here in the Dedalus booth. I'll let you get back to having a chat with people here. Thank you so much for your time.
Thank you very much.
Thank you, Peter.